Hi, this is Yael Shacher from Refugees International. Welcome. I'll just wait another minute before we get started to let people enter the webinar. Thank you for coming. Okay, thanks to everyone for coming today. My name is Yael Shacher, and I direct the Americas and Europe program at Refugees International, an organization that focuses on the rights and humanitarian needs of displaced people all over the world. Given that, I'll just step back and say that the global refugee population has doubled in the last 7 years, and displacement in our hemisphere has grown tremendously. Much of the migration has been within Latin America. For example, almost 400,000 people are seeking refugee status in Costa Rica, which has a population of 5 million. Aside from a short dip at the start of the pandemic, arrivals of people seeking asylum at the US southern border have been increasing for the past 5 years through the Trump and the Biden administrations, both. So the solutions being proposed today, which many of you have heard about in the news, I'm sure, and which have been tried over the past few years or are being tried right now, such as transit bans, heightened asylum standards, and expedited processing of people who arrive, are not those that Refugees International believes will meet the needs of asylum seekers or sustainable solutions for receiving US communities at the border or in the interior of the country. We actually have a take action related to this that my colleagues will put in the chat if you're interested in those issues. Now, since April of 2022, when the buses started arriving from Texas and Arizona to the Washington, D.C. area where I'm based, I've monitored both reception at the border in border communities and in the District of Columbia here. In a forthcoming report, I'll tell the story of some of the people I've met. For example, 3 Venezuelan women, all of whom arrived at the border and boarded those buses and had widely divergent experiences because of the way they were actually received after arrival. Our focus for this webinar will be on the issues that made all the difference for those women and for many of the people coming to the border, and where the true solutions for newcomers and for newcomers and for receiving communities alike lie. They are, for example, and we'll hear more about these through the webinar, coordination between federal, state, and local authorities and the nonprofit organizations that have the immigrant expertise and know what newcomers need. Emphasis on facilitating newcomer ability to get work authorization, legal support, and housing beyond shelters. And we actually have another kind of campaign going on related to work authorization that a colleague will put in the chat, and we'll hear a lot more about work authorization from our speakers. And third, funding this effort in the right way and most effectively. I'm now going to turn it over to my co-convener, Katrina Obzer from the Women's Refugee Commission, to discuss her recent report on many of these issues and to introduce the speakers for the webinar.
Great. Thank you so much, everybody, for being here. My name is Katarina Obzer. I am the director of the Migrant Rights and Justice Program at the Women's Refugee Commission. We are a research and advocacy organization that for almost 35 years has worked to improve lives and protect the rights of displaced women and children and families worldwide. I am so thrilled to be here, for WRC to be co-hosting this, and I'm particularly excited for the incredible lineup of speakers that we have here today. I'm going to start by just noting a couple of quick housekeeping issues before talking a little bit about this report, but then most importantly, turning it over to the other speakers we have here today. The webinar, as I think everyone already knows, is being recorded so that we can also share this out with folks who missed it. We really welcome and encourage questions and invite you to use the Q&A function to submit those, but we will wait until the end, until every speaker has finished their remarks, to dive into questions and answers. And I also just wanted to note that despite the tremendous expertise of folks on this call today, this isn't a call in which we can offer any particular case or legal advice. So the questions here are to talk more about things that can happen at systemic and policy levels. Before turning it over to our first speakers, I'll just recap a little bit the report that Yael just mentioned that Women's Refugee Commission published 2 weeks ago. For similar reasons as Yael described, as the number of people arriving in cities across the US has grown increasingly visible and with increased attention and need, WRC traveled this year to 4 cities in the United States to learn about how they were responding to the arrivals of people seeking asylum and to understand the best practices and challenges in supporting people. We spoke to dozens of stakeholders, including at the federal, state, and local government level, to community-based organizations, to grassroots advocates, to legal service providers, and to people who themselves are seeking asylum to learn about best practices and challenges to be effective and efficient, but also very dignified reception of people seeking, the need for dignified reception of people seeking asylum in US communities. I'll echo what Yael said. All of this is taking place in the context of really record regional and global displacement. There's a lot of talk about the numbers of people who are seeking asylum who are arriving in cities around the US. And there are broader phenomena at play here, like an affordable housing crisis also happening in many cities across the US that intersects with all of this. But at the end of the day, what we found from doing our research is that government at all levels, whether at the federal, state, or local level, has an opportunity to create and strengthen the long-term systems that are needed to support everyone who are in need of shelter and case management. Responding to needs of new arrivals only through a crisis framework, we found, does a disservice to what is actually possible. And what I want to just also really underscore from Women's Refugee Commission's perspective is that the negotiations currently happening in Congress that are being proposed as potential solutions would have, in our opinion, the exact opposite effect. They would create chaos at the border. They would harm people seeking asylum. They would create truly dangerous situations for those who most need safety, when what we need is a safe and orderly and just and humane asylum system in the United States. Every city that WRC visited has different systems in place that people need to navigate, but there were several cross-cutting themes in what we saw that you're going to hear about from everyone here on this call, many of whom, actually all of whom, are people we met with as part of our work on reception. And the report that we published has a number of recommendations to all levels of government and to philanthropy on how systems can be improved to support and receive people seeking asylum, while also transforming systems in the longer term to more broadly support people who need social housing and other supports. There are a lot of recommendations in the report. I won't go into all of them, but I will just end by saying states and localities, we think, need to provide leadership in welcoming and integrating people seeking asylum and coordinate with institutions and organizations to ensure responsive and sustainable and innovative reception. We're supportive of establishing and expanding programming for funding for benefits and services and supports. And we strongly believe in the need to engage the expertise of and community trust with the incredible community-based organizations who are providing services to asylum seekers and migrants across the country. We think Congress really needs to prioritize and substantially increase transparent, flexible, and responsive investment for states and local governments and for organizations providing housing and services in all of these communities. And we think the Biden administration really needs to establish and lead a whole of government approach to coordinating reception of people seeking asylum in the US. There's much more in the report, but like I said, I'm going to stop here and just end on the fact that what we really saw when we did this research was an extraordinary number of people in both the private and public sectors coming together to try to meet this moment. And you have some of those people on this call today. So it is a privilege to begin by introducing our first speaker from San Diego. Kate Clark is the Senior Director of Immigration Services at Jewish Family Services San Diego. At JFS San Diego, Kate oversees both the legal services and respite shelter services, where more than 165,000 individuals have been welcomed with dignity and compassion since 2018. And so Kate is here to talk a bit about what is happening at the border today. Thanks so much, Kate.
Thank you, Kat, and thank you, Yael, and thank you for hosting this incredible opportunity to share. I think in conversations like these, it's actually the intersection of policy and infrastructure that we're able to dive a little bit deeper in. And really, I think building upon what you said is that collectively, we all have an opportunity to welcome, and we all have the opportunity to be part of that solution in many different ways. And so I'm happy to share how that's looked like in San Diego over the past 5 years, and also how it's looking today, and really with the eye and focus of how we can be solutions oriented going forward. So I apologize for those that have heard the foundational story of the Rapid Response Network, but I think it's one that is important to highlight, especially when we're talking about public-private partnerships and how we can be successfully welcoming folks in our community. So in 2018, and really just wanted to uplift that even before that, there has been this incredible collaboration of NGOs and advocates and grassroots organizations in around San Diego. But in 2018, when there was a federal policy change, literally overnight with no notice, individuals and families ended up being dumped on the streets of San Diego with no resources. And so at that point, our community mobilized a response, which later professionalized and turned into the San Diego Rapid Response Network Migrant Shelter. And as Kat noted, we've welcomed more than 165,000 individuals into our care. Importantly, it is a respite shelter. San Ysidro Port of Entry is actually the largest land border crossing in the Western Hemisphere, and we receive guests from across the world who are accessing protection in the United States. And so from a service provider, so JFS is a resettlement organization, we're a legal service provider, and this was a new area for us to step into, but really with the lens of framing public health and actually legal empowerment, we began to build out our shelter services and scale a model that really focused on providing folks with, of course, safe basic needs. So that's the shelter, the food, the travel coordination, the transport, but really medical, right? So we have the privilege of being co-located and having the support of a medical provider, UCSD, who's able to triage the urgent needs of all of our guests to ensure that they are safe and that they are well enough to move on to their final destination once we determine that that is the best position or step for the guest that's in our care. And then the third is really legal empowerment, and that's looked different throughout our sheltering and of course depending on our capacity, but have the privilege of having a legal services team in-house to be able to support the variety of legal needs that our guests have. And that also could be, for example, as simple as changing an address or updating paperwork, corresponding with DHS and its sub-agencies to make sure that the documents are accurate and support the non-citizen's ability to move on. Or in moments like today, we are actually co-located, or USCIS is actually co-located at our one of our facilities to be able to support with work authorization for our guests so that they're further supported and can be on a path to self-sufficiency once they arrive into their final destinations. And so I think that the top line is there is an ability to welcome, there's an ability to center the humans that are behind this political football that we continue to see playing out in the headlines across the country. But there are significant solutions that when government comes together to collaborate, and we've seen that in San Diego, with certainly the ability for us to access federal resources, which I'll talk about in a minute, but an incredible investment from the state of California, which I believe is more than $1.5 billion over the last 5 years. And more recently, local government. So when we come together to succeed and center, again, then again, we're more successful in being able to support the immediate needs and longer term needs of folks that are passing through our care. I'll briefly mention, because I think it's really important, especially for what is happening now in San Diego. So I'm sure folks have seen, but the headlines are again that there are street releases in San Diego, and that's, I think, a perfect example of where there hadn't necessarily been planning and coordination ahead of this time where there's been an increased number of arrivals, and certainly the horrific circumstances of folks that are being detained between the border fences. And so really welcome recent investments from local municipalities like the County of San Diego. And importantly, the investments need to be coordinated, right, with the existing welcoming infrastructure that is has been built over the last several years. So the top line again is like all levels of government need to be invested in these sustainable solutions so that infrastructure can be built and scaled, which is certainly what we've seen happening in California, and there's ample opportunity for building that out in a more meaningful way. I'll touch it based on the federal funding because I think it's critical, especially in times like now with what we're seeing coming out of Washington. So the Emergency Food and Shelter Program, or EFSP, recently transitioned within this last year to the CBP and FEMA Shelter and Services Program, or SSP. And this has really been a lifeline of a resource to, I'll say, sustain the existing capacity. And I use that word sustain really intentionally because unfortunately, with how the program has been structured, it hasn't allowed for there to be meaningful expansion. And on the heels of what I just shared with the incredible infrastructure that already exists, and for example, in San Diego, but for there to be a need for it to be expanded, we have been hindered from being able to do that because the federal funding comes, potentially, right? It's not always a guarantee. It's usually an 11th hour decision where we learn if it's going to even exist or not, how much resources are going to be put into that, and really just not having the multi-year contract to be able to meaningfully again expand or increase the existing infrastructure. So I think that it's a start. We absolutely need to see that continue, and we need to, of course, continue to see dollars from that program be allocated towards the federal government, in addition, of course, to the needs of the receiving cities and other parts of the country. But how I look at it is if the border is not resourced from an infrastructure perspective, then it's really going to be quite challenging for our colleagues in other parts of the country to continue the baton, if you will, passing it on to other cities and municipalities across the U.S. So I look forward. I'm happy to answer questions at the end of the call, but I appreciate again the opportunity to share. So thank you.
Hey, thank you so much for those remarks and underscoring again the need for coordination is such a critical piece to making welcoming work. I'm going to turn it now to Atim Oti, who is the director for the Denver Office of Immigrant and Refugees Affairs. Atim and her team lead immigrant integration work that educates and informs all city agencies and offices on issues impacting Denver's immigrant and refugee communities. The Office of Immigrant and Refugee Affairs, works in partnership both internally and externally to develop and implement various policies to envision a more welcoming and inclusive Denver. So Atim, we are so excited to have you on and hope that you can speak a bit to some of the city and state systems that are appropriate and needed for this kind of response and how they're evolving. To do so, Atim, over to you.
Yeah, thank you. And I will just say, I think like the emphasis on internal and external relationship and partnerships has been super beneficial, but also could use some tweaks. And I think we're learning as we're going. So as Katerina said, I am with the City and County of Denver. And I'll just kind of, Kate, thank you for kind of building up what happens, along the border. And then I will try to kind of take your baton and talk a little bit about, what's happened on the interior side of things. We, as a city and county, weren't really engaged in what I know for many of our border communities has been going on for decades. But really, we didn't get our kind of introduction until December of 2022, when we definitely saw a large increase of newly arrived migrant and asylum seekers who were coming to Denver. We are just geographically, we're about 15 hours from the Juarez El Paso border. And so it's a little bit of a straight shot to Denver for various reasons. Some folks have been staying in Denver and others are just kind of, this is a bit of a transit location that is quick enough to get out from the border, but is not necessarily folks' final destination. I will also just note, I think climate-wise, Denver is in an interesting situation because I know as folks are migrating from South and Central American countries to get to the southern border, the weather is very different than it is in terms of just our climate. We have a lot of snow, a lot of cold. Unfortunately, more cold than snow these days. But that, I think, also compounds some of the emergency response that we've had to, or that we've been challenged by just based on the number of individuals who come. I know, Katerina, you just talked about the unhoused and that also being another response. Our city currently has gone through a mayoral change that is very focused on housing our unhoused residents. And so during cold weather activation, that's definitely a bit of a challenge because we really are at that moment trying to save lives just from the cold itself. But to go back to kind of our response, Denver, we have an emergency plan, which has been helpful. One of the agencies involved in that plan was our human services, and they are responsible for mass care. So anytime that there's any sort of response involving humans and a large number of human population, they would activate. And they're only supposed to activate for, maybe a 1 to 2 day, maybe even a 2-week activation. But we have seen that, at least in Denver, we've had, I would say, an on and off activation for our emergency operation center that has kind of coalesced all hands on deck from all agencies. So we've got folks from our housing agency, our emergency management kind of leads our command center, but we have our Department of Safety, so fire, my agency, the Human Rights for Community Partnerships, finance. And we are all kind of working on how to best respond in an emergency situation. And I will just add that I think based on kind of the speed at which we had to respond, I think an emergency apparatus was helpful to kind of really bring everyone together. But I will also say that it is equally important to have those relationships. And now I'm going to go into that external space of, do you know who your counterparts are at the state level, local level, federal level, or do you have relationships with any of those partners who may be important to engage, come an emergency situation and or just for planning purposes. I think for some cities who may not be kind of in the emergency response, this is a real good time when there is no emergency to start having conversations with either counterparts or folks that are maybe similarly situated, and really trying to have a little bit of a pulse check on the health of those agencies and whether those individuals have the knowledge, capacity, infrastructure to kind of support some of the issues that you'll be confronted with. In terms of best practices, I would definitely hone in on, I think our nonprofit partnerships have been instrumental, vital, amazing, whatever else I can say just about how critical they've been. And not only because they are our subject matter experts, and have that expertise on the ground, But because of the ability to gain trust very quickly for folks who have gone through a very traumatic journey just to get into the United States, and then let alone, now start looking at, okay, am I going to resettle in a place that's very cold and has mountains and snow? Like, what's happening here? So that has been really helpful, I think, just to engage our new residents. Some are staying here, and we want to make sure that they feel welcomed. And our nonprofit partners have been critical to that. Fast forward a little bit, in terms of a long-term kind of response, I think one thing that we recognize and want to lean into is how we create more sustainability within our nonprofit partners, so that they can continue to do the work that they've done, but to really support infrastructure. So everyone's been, tied and limited in capacity, but how do we build out that capacity? And I know, Kate, you talked about funding is definitely a ridiculous need and a dire need, not only for us as a state, but also, as a city. And we've gotten support from the state, a little bit from the federal government, but I think this is really where philanthropic dollars have really done a tremendous service to our nonprofit partners. But how we now as a state, I keep saying the state, as a city, need to be thinking about how we utilize those relationships to really build out the work that we want our nonprofit partners to do. And I didn't even get to touch on as many things as I have in my notes. So hopefully there was some time for questions where I'd like to just kind of explain and explore some of our best practices, but also lessons learned. Thank you.
Great. Thank you so much, Asim. It's so great to have you here. Thank you for those remarks. I'm going to turn next to Camille Mackler, who is the Executive Director of Immigrant ARC. Oh my gosh, I'm so sorry. I just lost where I was. It's a coalition of immigration legal service providers in New York State. She's also a senior visiting fellow at the Truman Center for National Policy. And Camille is going to talk a little bit about what is happening in New York City, how some of the key challenges that have been faced in New York City have been addressed, and also talk about some of the really great solutions and models that are working in New York City and that, can and should be looked at by other places. So Camille, over to you.
Hey, Kat. Thank you everyone for having me. Hopefully you can hear me okay. I apologize for the croaky voice. And it's great to be here today. And I wanted to echo a lot of what Atim just said about building capacity, especially, and thinking about how we can meet the needs of these individuals and families as they're arriving here. New York has historically led the way in investments in legal services, especially both at the city and the state level. I think we're one of the places in the country that has the most resources and the most investments allocated. We also have a huge number of people coming, sort of same to Kate. And at the border, it feels a little bit like the border has shifted to New York City and New York State in the last year or two, which has been an interesting exercise. But also thinking about how we get creative and we maximize the investments that are important is a lesson that we are learning increasingly. For years, New York City and New York State increased their investments in legal services, but did it in very siloed ways. We sort of put a lot of money towards detention when NIFUP was created in 2013, and then 2014 it went towards kids and then families from Central America. And then as the different needs occurred over the different years, we saw a lot of this very siloed funding come out. And so now we're really at this moment where we're thinking about how do we take all this, leverage all of it, and make it more replicable time over time. So I'm sure you've all seen the headlines. We've been getting, a lot of people to New York City. Many of them choose to travel onward. Others come to stay. Increasingly, we've seen people coming to New York City who don't have any ties or connection to New York City, which is, I know, a shift that we've been seeing at the border and that we are definitely seeing here. And that has posed its own challenges. And there's been a lot of different responses from the city administration, the state administration. I know you want me to talk about the city, but it's sort of a little all interlinked at this point. And it's also just been a bit of an interesting exercise in seeing the different responses. And I do want to say for our colleagues at the border that I acknowledge that some of what we're dealing with now and acting like we've just discovered has been going on for years. And so that's been, there's been a bit of a learning curve for us, I think, as we sort of confront the needs that oftentimes get addressed at the border. And then sort of by the way they make it up to us, were typically more resourced than they are now. But a lot of individuals have been going into shelter, seeking shelter, or otherwise not having a stable place to stay. You've all heard, I'm sure, the comments from our mayor. There's been a real schism between government and the nonprofit sector in New York over this. And it's really, really sad to see what's happening because we spent so many years. I mean, my organization, IARC, comes out of the coalition effort at JFK Airport during the Muslim ban, and so many other coalitions and so many other collaborative efforts that came out over the last, decade or so that led to these increases in investments and that led to all of these amazing resources to be created. And we're sort of seeing that fray now as the different responses, particularly the different political responses, have really put a lot of pressure and have created a lot of division. And I think there's a lot of reasons for that. I don't put the blame on, any one thing. I think there's, we have to acknowledge that our field, at least the immigration providing field, not just legal services, the immigration services field in general is extremely burnt out. Compassion fatigue is at an all-time high, and thinking about how we continue to do this work against, ever insurmountable odds, it definitely takes a toll. So I don't want to discount the effect of that. But in the city, we've definitely seen this division. New York City ultimately chose to create their own legal services operation. They started an office in New York City, in City Hall, called the Office of Asylum Seeker Operations. They opened an application center last June with the purpose really to crank out applications. I think they do about 1,000 applications a month on average, is what we sort of get from the press releases. They hire private bar attorneys and other individuals, attorneys or not, to complete the applications. It's a pro se model, meaning that once the individuals leave the center, then that's it. They don't have the ability to come back and get other help. Legal service providers and other nonprofits in the city got very, very, very little funding, almost none from the city itself. And the state did try to step in, but we sort of just all, I think, being overwhelmed by the need that it is, we've been driven by numbers and not really thinking about how to build out the capacity more sustainably, and certainly not for the long term. And I don't want to knock what the mayor has done with the Asylum Application Center. I think there's really positive things happening there in terms of a crisis response. And it's not a response to a crisis of migration, because migration is not a crisis. But it is a response to the crisis of representation that we're all facing, which is that, we've got some of the most backlogged courts in the country, some of the most backlogged USCIS offices in the country. You may have seen the headlines, people have to line up at like 10 p.m. the night before, just to get into our federal buildings to make their ICE check-ins. So we definitely have a need that is beyond overwhelming at this point. And now, so having a pro se model to sort of make sure that people, at least when they're walking into court, have something with them, right, to keep their cases going, has been helpful. But unfortunately, the conversation that needs to happen between stakeholders and government officials at both the city and state level have really broken down. And so we aren't having the conversations we need to have about what a holistic, continued response looks like, because these individuals, it's great that they get an asylum application or a TPS application. Eventually, maybe they get a work permit. But then what happens when they get their asylum claim denied, and all of a sudden they've got a deportation order, and their work permit is now no longer valid, and they're still going to need services. There have been moments of hope. We did collaborate. IARC collaborated with New York City, New York State, and USCIS to host what has now become sort of a trend, I guess, nationally, of doing these work permit clinics and TPS clinics, where USCIS is on hand to accept the applications, to adjudicate fee waivers, to issue receipts, to capture biometrics. And those moments really just, I think, showed the power of what can happen, what can be done when all levels of government and the nonprofit sector, come together to work together. In 10 days, we did over 1,700 applications. I know that those efforts were replicated in other parts, but unfortunately, we haven't really seen the sustained momentum. But I will say that I think for me, I still take hope by the fact that that when we do these efforts, New Yorkers come out consistently. We have every single time we've had to turn volunteers away. I'm just, on my local neighborhood mutual aid association listserv, and the other day someone posted that they were trying to raise $1,500 for an asylum seeker to get out of a shelter and put the down payment on a room, and they raised it in an hour. Every time there's a need for a driving, a clothing drive or anything like that, like people just show up. And I think what we really need to figure out, both at the city level, the state level, and honestly with everything that's happening in Washington right now at the federal level, is how do we make it clear to our elected officials that we don't believe in the rhetoric that they're promoting, that we don't believe in this sort of crisis narrative that they're putting out there, that we know that these individuals who are arriving to New York, maybe in higher numbers than before, maybe less resourced than before, present an opportunity, not a challenge. And if we invest in them today, we know that over time, we're only going to be better for it, stronger for it, and grateful for it. And so that, I think, is the call to action for me, is how to, make your voices heard and make sure that you let your elected officials know that you don't stand for policies that are not welcoming, that you don't believe that that is the way it is. And certainly New Yorkers prove that to me every single day. So.
Well, on that note, thank you so much, Camille. What a way to close out with such a lovely call. I'm going to turn to our final two speakers who are here to present jointly, and then we will turn it to, I know there's already been a number of questions that have come in, so I'm excited to turn those to our speakers. But coming to us from the state of Maine are Joanna Testa, who is the program director of the Asylum Seeker Transitional Housing Program at Catholic Charities in Maine. She's been welcoming and serving families seeking asylum from Central and West Africa and Haiti for approximately 5 years, as well as Julie Allaire, who is the Chief Program Officer with responsibility for refugee programs and asylum seekers, and earlier in her career was a diplomat with the U.S. Agency for International Development. Julie and Joanna are here to talk a bit about the model of providing wraparound services and case management to people seeking asylum who are arriving in Maine, and some of what they've seen and learned in the last couple of years of doing this in particular. So over to you two, and then I will open it up for questions. Thanks.
Thank you, Kat, and thank you, Yale, for the opportunity. It was wonderful to hear from the other speakers about their programs, and I can see that we are moving farther north from the border into colder territory and more away from emergency response to building of systems and partnership with government. So the starting point for us is that Catholic Charities has been doing refugee resettlement work since 1975. And in July of 2022, we launched a pilot program for transitional housing for asylum-seeking families. It is adapted based on our best practices around refugee resettlement. And the idea was really to test a purpose-built model of case management, coordinated services, and housing to help people achieve better outcomes than we were seeing in the emergency response of people being placed in overflow shelters. 300 people live together in a facility that's dedicated exclusively to this transitional housing program. I also want to highlight, there's an expression in Maine that says Maine is a small city. And that simply means that it is a large geographic state, but you have access to people at all levels of government, and the networks are dense. As a result, it was the state of Maine and the city of Portland who actually approached Catholic Charities Maine to do this pilot. They are full partners in this work. We created and are running this pilot. The state funds the contract, and the city of Portland's General Assistance Office determines eligibility for participation in the program. And what's unusual in Maine is that asylum seekers are eligible for general assistance. So as the general assistance budgets were under more pressure due to growing unhoused populations, the state was looking for ways to take pressure off this budget. And that's where this idea evolved from. At the same time, we were seeing that asylum seekers comprised the asylum-seeking families, that is, comprised the largest portion of the unhoused population. So what began was a series of monthly coordination meetings with the state, with various cabinet agencies, departments of education, school districts, general assistance offices, and nonprofits to troubleshoot how to do this. This asylum seeker transitional housing program has a what I would call 2 hub and spoke models to it. One hub is the state. They are at the center of the funding model, and they fund a set of complementary contracts. One is with Catholic Charities for the service delivery. Another is with a hotel to rent the facility. There's another large network of contracts with partners that provide specialized complementary service, ranging from housing navigation to immigrant legal services to cultural services. And so that's sort of the funding model. And the idea there is really that each agency which has that expertise as a core element of its mission is best situated to deliver that. And that allows Catholic Charities to focus on our core competency of case management. The second hub and spoke is the service delivery hub and spoke, and Catholic Charities is at the center of that. There are, and Joanna's going to talk about that in much more detail, but I will just say that there are 3 elements to the model. There's case management itself. Again, best practices drawn from what we've learned in decades of refugee resettlement. There's the coordination of complementary services with partners is a huge value-added piece of this model. Catholic Charities is able to proactively engage the partners, bring them on site at the point at which their services are needed, and essentially help connect people to services at the earliest point of their eligibility, so resources of ourselves and the partners are efficiently used, and so that asylum-seeking families are not either missing their periods of eligibility or approaching things earlier than they should. The final piece that's drawn from our experience with refugee resettlement is the use of data. So we designed, we have a good intake system, and we designed a data tool pretty early on that's getting ready to be rolled out in more detail, but that allows us to track people's progression through this continuum of services. And it's really allowed us to understand and describe the pathways that people move through. All of these pieces coming together has really put us in the position of being able to identify trends, gaps, and challenges as they emerge, and then proactively bring those to our conversations with the state and with the nonprofit partners so that we jointly troubleshoot solutions to those. And then we can really timely implement policies to address them. And we're all on the same page, messaging the same things with asylum-seeking families. I'm going to turn it over to Joanna to really talk about the operational pieces of what this looks like on the ground. Thank you very much.
Good afternoon. Thank you. Thank you, Julie. So as soon as families arrive from the city of Portland, whether from overflow shelters or other overflow placements, they have some of their belongings inspected in an educational process with our residential staff to examine whether or not there may be any bugs that are being brought into the facility. We try to eliminate that before people are actually brought in, and also to do some education about proper food storage to eliminate any exacerbated circumstances that would draw or hold bugs. So that kind of happens right off. And then secondly, we do kind of a rules orientation and explain consequences immediately. And this is really an introduction to some of the US law around the supervision and discipline of children, as well as domestic violence episodes, so that people have that information right from the beginning and understand what the expectations of shelter are in this facility for families. We do a lot of signing of consents to release information so that referrals can be made immediately and people can be connected as soon as possible. Some of the things that they're eligible for immediately would be general assistance and WIC with the Women, Infants, and Children's Program, if they're eligible. General assistance does a financial assessment of the family's status, and if the families are found to have zero income, having proof of zero income is what is making them eligible for many of the other benefits and services that are provided, including some of the medical services, as well as some of the food stamp and TANF benefits from Department of Health and Human Services. So we are bringing folks on site. This is really we have our case management staff on site. Our offices are all located on site in the hotel. And then we use the conference rooms to introduce partners and have those partners explain the institutional demands or rules that they have, so that families are hearing it right from members of our community. We do school registration on site. The McKinney-Vento liaisons are on site. We also find out about people's healthcare status and needs, and try to connect them to partners that is in conjunction with our local international clinic, doing capacity building with medical providers in the area to understand the primary concerns or needs of those that are arriving newly to the country that may have not received medical care in years. We are also working with the Center for Disease Control and reviewing vaccination status and working to get people to a place where they have all of the vaccinations needed for public school attendance. Adults are doing CASAS testing and on-site registration for English classes that are delivered on-site levels 1 to 6. Those happen several days a week. We bring lawyers on site to give information that is accurate about the asylum process and to connect people with volunteer attorneys that are working to help people file their asylum applications correctly. And then we also work when the case managers are working as people have applied for asylum to have people reapply for the benefits that they are now eligible for with asylum pending status. And then we begin tracking people's A numbers and the days that they have applied for asylum. So as soon as they hit the 150 days, they are connected with a clinic to apply for their work authorization. And during that time, we have pre-employment services offered on site in conjunction with the Department of Labor. The families are also doing intakes with housing navigation partners so that permanent housing can be located as soon as possible for these families. And that is in conjunction with general assistance and some of the funds from the state that Julie mentioned. We are doing a lot of education about successful tenancy and what a lease and landlord relationships look like here in the United States as well, so that people can be successfully integrated into the community. Thank you.
Amazing. Thank you so much, Julie and Joanna, for describing in more depth one model of what reception can look like and how important it is to incorporate that refugee resettlement lens right from the start in thinking about how to receive people seeking asylum. You've heard a lot here. I will just recap a couple of themes that really stood out to me. One is the importance of investing, not just in infrastructure to begin with, but also in existing welcoming infrastructure, so that we're building up what already exists. And the importance of seeing the border working in tandem with the interior, that these are two essential pieces of the same puzzle, and that resourcing and infrastructure conversations have to be about both, including conversations around the Shelter and Services Program funding. It was really wonderful to hear about the importance of actually embracing welcome at the city level, and the importance of emphasizing the need for more sustainability within nonprofit partnerships, so that, again, the theme of there's already so much work that exists, how can it be built out and sustained in the long term? Similarly, the importance of ensuring that the work isn't happening in silos, that it's coordinated, so that, Camille, I thought you made that point really, really beautifully, that even when there is a lot of funding and infrastructure that exists, if it's not working in tandem, if it's siloed, then it's not as effective and efficient as it could be in a place that is, much better resourced than others. Finally, I'll just lift up again Julie and Joanna's points about the refugee resettlement lens as a starting point rather than perhaps the crisis response lens as a starting point, and being really important in developing sustainable models and this idea of a purpose-built model that you can actually test and evaluate. So we have a ton of questions. We're probably not going to get to all of them. I will just preface by saying that. But I wanted to start with one of the first ones we got around how can we expand support for the shelter services program and provide greater access for states in the interior that are endpoints of migration to that program. And I'll just note that there was a similar question later on around how can we ensure that the federal government actually funds things properly. And people may answer this however they are able to, and not everyone has to answer the question. But certainly Kate, Camille, Yael, Atim, you all may have thoughts on, and any of you may have thoughts on this. I don't know who wants to go first.
If I
Kate,
can, I'll just say,
Atim, please.
Oh, sorry, Kate, go on.
No. Go ahead, Atim.
I was just going to say, I think this has been the SSP program, and then previous EFSP has been, I would say, a lesson learned in terms of we needed to have gotten more involved with our FEMA regional representative, but also our local boards a lot sooner to really understand kind of, who was going to support our nonprofit partners in terms of maybe a fiscal agent, but also what reimbursement the process is going to look like. And we unfortunately have only received, just shy of $1 million, even though we have submitted applications for over $9 million. And so I think just even having a better realistic sense of kind of what that reimbursement process was going to look like and how to kind of move it faster would have been and would be really helpful. But I think from the federal government, that could really look like doing some like one-on-one training or training from the national board down to the various regional partners so that folks are equipped and ready to go to apply for that type of funding.
I will say that I think it's also about how we talk about the funding, and I think it's a little bit of a difference between being at the border, so I don't know that I have the talking points exactly on point for our friends that are in the interior, but really at the border, the shelter and services program dollars are an opportunity for us to maximize a coordination really with the federal government, including sub-agencies that are CBP, OFO, Office of Field Operations, Border Patrol, and ICE, in ensuring that there is a warm handoff, if you will, of the folks that are being released from DHS custody into NGOs cares. And so it really hovers around maximizing efficiency, of course, with great outcomes of the individuals that are going into NGO respite shelter cares, primarily at the border. Also having folks at the federal level have an understanding of the very nitty-gritty operation. So what does that look like? I heard on this call that there is non-congregate shelter being used. What does that actually look like? Is it individual hotels, like an entire hotel? Is it individual hotels? It varies by region, and there's no one-size-fits-all approach that's going to work for the shelter and services program across the border, at the border and the interior. And so I think it's getting to those detailed conversations is really, really critical so that we can ensure that the federal funding is best being positioned to support the work that is being done both in the interior and at the border. And I think also just really making sure that our congressional representatives are aware of the opportunity that the federal government has with making this investment. And so that there is this public-private partnership of all levels of government that are bought into solutions to support folks. And so I think that early and ongoing communication with those members of Congress is really, really important too.
Thank you so much, Atim and Kate. Both super helpful responses. There was another question that came in, Atim, for you to elaborate more on the lessons learned that you referenced in your remarks. So perhaps you could do that. We'll do one more question after that, probably before we close. Thanks.
Yeah, I would say that I think the philanthropic dollars and really having more of a focused conversation, intentional conversation um, with the understanding of what nonprofit partners and faith community partners are equipped and ready to receive the work that needed to be done, I think was a big lesson, and we're continually learning that lesson in terms of where to maximize the dollars that are utilized by philanthropic efforts. And then I would say, I think lesson learned that we're, again, this is all like, we're building planes and taking them down, changing engines all at the same time, it feels like. But I think mutual aid from our regional partners and really trying to get ahead of having conversations with regional partners. So it's not just a city and county of Denver issue, but how to talk to other counties, talk to other cities. And we've definitely done that. But I think just exploring how those pre-conversations could happen. So when there are issues that come up, mutual aid can be extended a little bit more. And then I would just say last, I think a unique, I guess, characteristic of folks that are coming are the families, and really the makeup of families and how that impacts so many different areas of an individual's integration pathway. So we've got school, health, education, work, and so just really trying to I would say strengthen some of those pathways as best as we can, so that we are able to serve kind of the holistic family structure kind of simultaneously. So that's what I would say there.
Perfect. Thank you so much. Team, we're going to close out with one more question. Thank you all for having stayed on. I thought this was a particularly interesting one that it would be helpful to hear from any of you from. Is there or will there be a Center for Migrant Coordination to coordinate federal, state, and local efforts to support newly arrived migrants and reduce impacts on local communities? And if that's not the case, what policies would you all advocate for in terms of better coordination? So I think this is really a question about what would it look like if there were more federal coordination with regards to this, or in the absence of that, what other coordination do you all think is most needed?
I can start answering that. I think there have definitely been conversations around the need for coordination. It's been a little disappointing to see that the networks that did exist, for example, Cities for Action that was created a few years ago, haven't really been able to be leveraged, at least in the intercity coordination. I remember the first days that buses arrived from Texas to the Port Authority in New York City, and somebody in the New York City government's office was like, do you know anybody in, I don't remember, Philadelphia, or maybe actually in Denver? We need to be able to coordinate with them. And I'm sitting there being, why are you asking me for somebody in another city government? Shouldn't you already have that? Especially as they were sort of ramping up their reticketing efforts. But there are conversations happening around the need for coordination. And I think at the end of the day, until we address the broader systemic breakdowns of immigration, the need is going to be overwhelming to the capacity that we have. I mean, I'm in New York. We could take every single lawyer that we have in New York and throw it at this problem, and it would probably still be overwhelming. And so we need to be creative. We need to learn from each other. We need to share resources. We need to share strategies. Some of those conversations I think are appropriate around, across all stakeholders and government officials. Some of them need to be a little bit more divided up, just because you have to be able to talk to partners. But the conversations are happening. I hope that they continue to happen. I mean, just to give one example, and then I'll stop talking because I know we're at time. About a month ago, Denver, you guys were doing your clinics, right? Your EAD clinics with USCIS. And I was at a conference with New York people, and all of a sudden I get a call through our New York State Office for New Americans, who connected me with somebody from the Colorado Office for New Americans, because they were doing those clinics, and their provider there had a family who had a hearing. It was on a Saturday, and they had a hearing on Tuesday. in New York City, and all 7 people were about to buy plane tickets and fly to New York City because they didn't want to miss their hearing and get ordered deported. And so we were able to, first like connect with them and say, sure, if you need us to file a motion, we'll file a motion for you. But second of all, we were actually able to show them how to use the WebEx so that they were able to get on without having to buy those plane tickets. And so that kind of like learning and knowledge, there's a lot of technical assistance that goes in there, but there's also just that sort of, we need to be able to help each other out. And like, thank God somebody knew somebody who knew somebody who got to me on a Saturday so that I could connect to this clinic that was happening, right? But we need something a little bit more systemic. So I don't know about a Center for Migrant Coordination. I like the name. I don't know if that's coming from a specific conversation that I haven't been aware of, but I do know that the conversations are happening. And I think it's not only a great idea, I think it's critically needed. I mean, I loved meeting Kate a couple of months ago in San Diego, and my wheels have been spinning about how we might be able to coordinate better, from the border to the interior. I just haven't had time to send an email because the world keeps setting itself on fire. But Kate, it's coming, I promise.
Well, on that note, thank you. That was a great answer, Camille. I want to just take I know we're just past time. Thank you all so much for being on this webinar. Thanks to all of you who attended. Thanks to all of the great questions. I'm sorry that we couldn't get to all of them. I want to just close by noting that someone commented, I'm overwhelmed by your ability to persevere and continue in this essential work in spite of increasing pressures, opposition, and politicization, and may you find sources of strength to keep going. And I honestly don't remember when this comment came in, but I'm going to throw it to all of you because you're all doing incredible work. Thank you for being here and being able to unpack so much more of what is actually happening to people who come to the border seeking safety and then who travel onwards to other cities in the US seeking safety, and all of the support that they need and that you all offer them, and that we can scale up hopefully at a much bigger level around the country. And thanks again to everyone for attending. This is the end of this webinar. If you have any questions, please feel free to contact either us at Women's Refugee Commission or at Refugees International. And we will follow up with any final materials if there are any. Thank you so much, everyone. Bye.